Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Bronchiolitis. Pediatrics. Introduction. Bronchiolitis is an infection of the airways of the lungs. It mostly affects babies and young children. Bronchiolitis starts with symptoms similar to those of the flu and cold. Then it turns into wheezing and coughing. In most cases, the child's body fights the infection and the symptoms go away. There are things you can do to help your child be more comfortable. In some cases, the symptoms of bronchiolitis could become more severe, requiring that you see a doctor. Recognizing these symptoms is important so your child can get immediate care. This program is for parents of young children. It will give you tips for preventing bronchiolitis in your child, as well as tell you what causes it, what the symptoms are, how to treat it, and when to call the doctor. The lungs. Bronchiolitis is an infection of the lungs. This section makes it easier to understand infections caused by bronchiolitis. The lungs let us fill our blood with oxygen. The oxygen we breathe goes into our blood and the lungs. When we breathe in, the air goes through our mouth and nose and into our windpipe, also called the trachea. From the windpipe, the air we breathe goes into a lot of little tubes called bronchial tubes. The smallest tubes are called bronchioles. All along the insides of our bronchial tubes, we have a substance called mucus. The mucus helps trap dirt from the air we breathe. The mucus comes out when we cough. Very small brushes called cilia protect the breathing tube and lungs. The cilia constantly push the mucus out of the lungs. If there is too much mucus, we cough it out. Causes. The air we breathe has germs in it. Our immune system protects our lungs from infection by fighting most germs like viruses and bacteria. Sometimes, though, germs are able to get past the immune system and down into our lungs. When that happens, they can cause inflammation in the lungs. Inflammation is the immune system's normal response to contaminants or injury. The inflammation of the bronchioles is called bronchiolitis. When a child has bronchiolitis, the bronchioles can fill with pus, mucus, and other fluids. When the infection affects the whole lung, it is called pneumonia. In adults and older children, the bronchioles are wide because they've had time to grow. In babies and younger children, the bronchioles haven't had time to grow, so they are still pretty narrow. That's why babies and young children have more problems breathing when their airway is blocked by pus, mucus, and other fluids. A lot of times in babies and children, bronchiolitis is caused by a virus. Antibiotics do not fight viruses well. For that reason, doctors usually cannot order antibiotics to fight bronchiolitis. Viruses that cause bronchiolitis are in the air we breathe and the things we touch, just like the viruses of the flu and cold. We can get them from each other. It takes a certain amount of time, usually days, for a virus to cause an infection if the body doesn't fight it off. Bronchiolitis is contagious, which means it spreads from person to person. Preventing bronchiolitis is always better than treating it. You can keep your child from getting viral infections by washing your hands and staying away from other people who have flu-like symptoms or bronchiolitis. Children who are breastfed receive immune system protection from their mothers. That is why breastfeeding decreases the chances of getting bronchiolitis.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Signs and symptoms of bronchiolitis are similar to those of a common cold. Like the common cold virus, most cases of bronchiolitis occur in winter and early spring. Most children with bronchiolitis get some of the following symptoms: fever, chills, cough, runny nose, These symptoms last about 48 hours. Then the child's cough usually gets worse and he or she may start wheezing. In most babies, the symptoms get better without treatment. However, sometimes they get worse. They start having fast, shallow breathing. It also gets harder for the child to breathe. This is called labored breathing. The child may also gasp for air, causing the nostrils to get bigger or flare. The heart rate can increase, and the child can become irritable, tired, and sleepy. They may not eat as well and may vomit after coughing. The child may even stop breathing for short periods of time. As things get worse, the child may become dehydrated and not be able to fill his or her blood with oxygen, causing the skin and the fingernails to turn a bluish color. This is called cyanosis. In severe cases of bronchiolitis, the child may have to be admitted to a hospital and placed temporarily on a machine that helps him or her breathe better. Self-care. Most cases of bronchiolitis last for about 2 weeks. However, some children may have a cough for a few more weeks. Most children who have bronchiolitis get better on their own. The following are things you could do to make your child more comfortable. Encourage your child to drink a lot of fluid to prevent dehydration. Use vaporizers and humidifiers to help loosen the mucus. Have your child sit up to help his or her breathing. A bulb syringe can be used to lessen nasal congestion, especially before eating. You can give acetaminophen or Tylenol, but always read the label carefully to make sure you give the right dose. Do not use aspirin or medications that include aspirin to babies. They can cause serious side effects in young children. Do not allow anyone to smoke in the house. Ask him or her to smoke outside. Smoking can make the symptoms of bronchiolitis worse. When to see a doctor. If your child's symptoms become severe, you should call your doctor. Your baby may have to be admitted to the hospital and placed on a breathing machine. Severe cases of bronchiolitis can be life-threatening if not treated. Things to watch for are very fast breathing, breathing that is labored and causing abnormal movement of the neck and upper chest, high fever, coughing that's getting worse, not better, dehydration, increased sleepiness and lethargy, bluish color in the skin, lips, and/or fingernails. A doctor can usually diagnose bronchiolitis by examining your child and asking you a few questions. During the exam, your doctor will listen to your child's lungs with a stethoscope to check for bubbling or crackling sounds. He or she will also listen for rumblings, which mean there's thick liquid in the lungs. Any of these sounds could mean they have an infection. Sometimes a chest X-ray is needed to help your doctor know if your child has bronchiolitis. The child may also have blood tests to check if there is an infection. Treatment. In severe cases of bronchiolitis, the doctor can order medication that will open up the airways in the child's lungs. If the child has complications from bronchiolitis, he or she may need to stay at the hospital. At the hospital, healthcare providers will help your child breathe better with oxygen, nebulizer treatments, and intravenous fluids to prevent dehydration. In severe cases of bronchiolitis, healthcare providers will help the child breathe better with special breathing machines. Prevention. Babies who are at a high risk of getting bronchiolitis may be given a monthly shot for a few months to prevent RSV infections, the most common cause of bronchiolitis. Babies with a high risk of getting bronchiolitis are those born prematurely or with heart or lung problems. The viruses that cause bronchiolitis are contagious. You can help keep your child from getting bronchiolitis by following good habits, such as keeping your child away from other children with bronchiolitis, washing your hands often with warm, soapy water, keeping your child away from the toys or personal belongings of other children who have or are just getting over bronchiolitis, not exposing your baby to secondhand smoke.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. Bronchiolitis is a lung infection. It mostly affects babies and children 2 years old and younger. See your doctor right away if your baby has any of these symptoms: severe coughing spells, shortness of breath, labored breathing, fever, drowsiness or tiredness, dehydration, bluish color of the skin or fingernails. Preventing bronchiolitis is always better than treating it. You can prevent bronchiolitis by using good habits. Keep your child away from other children with bronchiolitis. Wash your hands often with warm, soapy water. Keep your child away from the toys or personal belongings of other children who have or are just getting over bronchiolitis. Don't expose your baby to secondhand smoke. With good habits, you can do a lot to prevent your child from getting bronchiolitis. However, it is good to know what to watch for in case your child does get bronchiolitis. Call your doctor's office if you have questions.
Thank you for using Explain.